We know that about 86 to 90% of our patients have a lipid deficient as the main cause of their dry eye. And since that's the main cause, we need to look for why it's happening. Many of our patients don't blink as well as they should, and that's because of what they do on digital devices. And if they don't blink appropriately, then what we see is their glands start to die away and get plugged. So we evaluate the glands very closely, and are they flowing with rich olive oil, or are they flowing with cheese, so to speak? And if they're flowing with something that's a little bit thicker, the gland may end up dying away. One of the other major causes that we see for dry eye is patients have inflammation. We used to use punctal plugs all the time for our patients, and many of us still use punctal plugs as one of our primary treatments. But if a patient has inflammation, we certainly don't want to plug up all those inflammatory cells in the eye. There's some new tests that are out there that allow us to understand what the tears are really like by looking at osmolarity or looking at the value of MMP9s, which are inflammatory markers. Once we know whether the inflammatory markers are present or not, we can then treat them with steroids or cyclosporin in the long term, or if they don't have that as the primary cause of their dry eye, those patients potentially could do very well with punctal plugs. Unless we can do this, we're going to see some major issues, and optometry is positioned to be the primary dry eye practitioner for our patients.